Hello and welcome to this episode of Aging Services Thought Leadership. My name is Majd-Alwan. I'm the founder and CEO of AIVantage AIVantage, which focuses on advancing technology and innovation, strategy, adoption, and growth, particularly in aging services. It is my pleasure today to welcome Redman, who is the Executive Director of EverTrue PACE of St. Louis, Missouri. And for those of you who are not familiar with PACE, PACE is short for Program of All-Inclusive Care for the Elderly. It's one of the best programs. I've been a fan of the PACE program because it actually it has baked-in incentives for the provider. It turns the provider into a payer and provider. And of course, you'll hear more from Drew. And hence it has baked in those incentives could be used for innovation, including technology innovation and so on and so forth. So again, welcome, Drew, and thank you for taking time to be on this episode.
Oh, I'm happy to be here. Thank you for inviting me.
Absolutely, my pleasure. So today, Drew and I will be discussing technology and innovation in PACE. But let's start by asking you, Drew, to share with the audience a little bit about your background, information about EverTrue PACE, and some of the programs that you have and offer for older adults.
I'd be happy to. Thank you. So again, my name is Drew Redman, and I'm the Executive Director of EverTrue PACE here in St. Louis. And at EverTrue, we're a senior living organization. We have life plan communities throughout St. Louis. We have communities in Illinois as well as Pennsylvania. We also have an Anywhere Care service line, which is our home and community-based services programs where we offer things like the guide model, private pay and home services, and then also PACE. And I have been with EverTrue for the last 14 years, and it's been really interesting to see the evolution, not only of the industry, but our organization. And, more and more people are choosing to have services brought to them. And so, as you said, PACE is in a really great position to be able to perfect and improve how we do that, hopefully, across the country.
Excellent. I think it really meshes well with the older adults' desire to remain independent and in their own home, or what's known as the aging in place movement, which is a term that I don't really like because it's not for everyone, right? But again, that's great. What trends have you been observing over the past few years with regards to technology and technology needs within the PACE program?
Yeah, so I would say in the last few years, what we're seeing a lot of is move toward a more hybrid model than maybe it was operated in the past. And so for anybody that's not familiar, at PACE, we have a day center where we'll bring participants to. We also have a home care team where we'll go into the homes and provide care, as well as a primary care clinic and therapy team. And so what we're seeing more is a shift towards, I'd say overall, less interest in the day center and more of a desire for us to bring our services to people, to their home. Many times a combination of those two things. So I think it presents a lot of different opportunities and ways for us to utilize technology to really figure out how do we provide that home-based care in a remote setting. So.
Yeah, absolutely. That's a great segue for my next question regarding technology and innovation, because again, in my opinion, and I'm an engineer by training, and I am a big believer in technology. I firmly believe that technology could be a great enabler for delivering services into the home whether that's safety monitoring or activity monitoring to identify sort of early signs of health and functional decline and provide more proactive care, or even chronic care management, right? Which we know all individuals, older adults especially, and those who are eligible for to be enrolled in the PACE program sort of usually experience a multitude of, right, hypertension, diabetes, and so on and so forth. So chronic care management could be enabled with technology. So what technologies and innovations are you currently using at EverTrue PACE or considering using?
Yeah, it's a great question, and it's a big question. It's an important question for the coming years. And so we have started. I'd say we're in the early stages. We're using some of the, I'd say, more simple things, like when we're in the room with participants in the clinic, our physicians and nurses are using the dictation software that goes straight into our EMR, so that it doesn't require that input. One thing, a bigger initiative that we're working on is really a hospital, a risk prediction model, and a risk stratification tool. And so, we are spending a lot of time to make sure that the data that we're collecting is good data and it's reliable data, so that we can use it to make decisions. And what we want to do is get to a place where we're figuring out what are those leading indicators that indicate some sort of change has occurred in this person. Because you mentioned PACE is one where our payment incentive is aligned with the participant. And so we're able to do things early. And so the sooner that we can pick up on those subtle changes, I think the better we're going to be able to provide that care. And one that we've looked at, we haven't made a decision on, but, as I mentioned, more and more people are choosing that home-based care. And so there is technology. There's different challenges related to in-home technology, particularly with seniors, and one of those being actually wearing it when you refer to the wearables. That's a real challenge, and so we have had the opportunity actually to see a couple of products where the technology, I forget the exact term, but what it's doing is using kind of like radar to understand changes in your behavior pattern. So, for instance, if somebody doesn't go to the medicine cabinet all day, that's a pretty good indicator that they didn't take their medications. And so there's multiple use cases like that will help us in this new or in this healthcare world of providing for the most frail, not in the nursing home, but in their own home.
Right. Yeah, that's an excellent example. I'm a big fan of what is known as passive monitoring technologies, where sensors are embedded in the environment, like whether it's radar or motion sensors, switches on cabinets and appliances, and so on and so forth. I'm also a fan of what is known as AI-powered caregiving, right? Coupling the findings of the monitoring data with sort of prompts for the older adults themselves, like reminders, for example, if they're at a full risk, reminders to, when they get out of the bed in the morning, to sit on the edge of the bed instead of getting up suddenly and becoming hypotensive and syncopal and falling and breaking a hip, for example, right? So that's a great direction. So has the technology and innovation that you launched created a positive impact, whether those impacts were on care quality, efficiency, staff retention, patient outcome, satisfaction, care costs, because again, I know that the PACE program is at risk, as you mentioned, with when an enrollee goes to the ER or hospitalized or experiences a hospital readmission immediately or shortly after being discharged from a hospital. I would love to hear your perspective on those outcomes.
Yeah, well, some of the technology that we have chosen, some has worked great and some, has not worked out exactly as we hoped. And one thing that, I've found to be true is that, especially when it comes to technology, you have to know what problem you're trying to solve at the beginning.
Absolutely. Yep.
I cannot tell you how many, products we purchased because of one particular problem that we had, but without taking into account, the entire operation. And so I think it's important that, what I found is the ones where we've got more operational knowledge looking at it and we have a clear understanding of what we want to do, it goes better and for a number of reasons. It needs to, the workflow should be considered in the design phase, as opposed to, we try to retrofit a lot of products that maybe were designed for a hospital or other healthcare setting. And so, where you try to solve a problem with one product, then it turns into two or three. So.
Yep. I know it's like forcing a round peg in a square hole or vice versa. I totally hear you. And the other thing, in addition to the workflow, the fit for the workflow, is also there are things related to the product design itself. So ease of use and how many clicks does it take the caregiver who's busy and overwhelmed to get to the right screen or to get to the right report, and so on and so forth. The other aspect is understanding the root problem, right? Or the root cause of the issue. A big example, an example that I often bring up is falls, right? There are so many different root causes for falls, and not all of them could be addressed by one solution or one technology. And the last thing that I want to say regarding to this, and I'm an engineer and I have all the respect to engineers and technology developers, but sometimes engineers and technology developers have a solution looking for a problem, as opposed to discussing the root causes of the problem and the full aspects from the actual operators and caregivers, and then suggesting the right or the most appropriate technology solutions. I hear you. So great. Have you already tested done a pilot with the radar-based monitoring system, or is that still under consideration?
So that one is still under consideration, but it is something that we're interested in. We're also looking, medication adherence is a large risk for seniors, and and so we are in the early stages of implementing a product that will do medication reconciliation automatically. And for anybody in healthcare, that transition of care between hospital, nursing home, PACE, whatever the case may be, there's a lot of hands in the pot. And so, having the ability to do that med rec fast and timely, it lets us use resources in other ways.
Yep. It's easy to add a prescription, but we usually forget to take out all prescriptions. And trust me, I know that from my own health record. Whenever I visit my primary care physician, he says, "Oh, are you still taking this?" No, that was for a specific sort of pain period. It was temporary. Why is it still on my record? Yeah. I hear you. Yep.
Well, and big picture, that's the healthcare system as a whole is so fragmented that, it is exciting, really, to see where technology has helped in other industries. It's exciting to see that start to make its way into healthcare. And I mean, what a great time for it, as we deal with, staffing shortages, people wanting to do remote-based, home-based care. So technology can help us overcome a number of those, barriers that are starting to present themselves.
Absolutely, especially in this day and age of artificial intelligence. Artificial intelligence AI tools are becoming really powerful and can help in a lot of those aspects. So, and again, we can have a whole day conversation about the available tools that can help with different aspects. But let's start with sharing some of your top challenges, that maybe 2 to 4 challenges you see in the sector, specifically in EverTrue, if you're willing to share. And what suggestions do you have for technology that could help address those challenges?
Well, so yeah, that's a big question. I think I have to start with, I know I just mentioned it, but the fragmentation, within healthcare, and that exists between providers in different settings, but it actually also exists even inside the same organization or same building.
Absolutely.
And so I would say one of our biggest barriers is or biggest challenges that we need to stop and understand is, like I said earlier, what problem do we need to solve? What is the highest risk? What is the most pressing issue that we need to solve, so that we can have our people working at top of license, is the term we use. No one wants to pay, a physician, and a physician didn't go to school to do, data entry or, and so we want to use technology. That's how we look at it. How can we free up our resources, our most valuable resources? And that is the people that are providing the care, and the people that are, looking at the whole person, because that's also something that's different in PACE. Housing has an impact on their healthcare. It goes beyond the medical. And
yes, allergies, for example, if they have mold in their home or infestations. I know that the PACE program would cover mitigating some of those issues as well, because they have an impact on their health condition and the frequency of flying into the hospital, right?
Yeah.
Or utilization of healthcare.
Yeah, absolutely. And so, the better, I look at my role as a big part of my role is figuring out, how do I get the right information in the right hands at the right time? And so that's where we can utilize technology, where we can continue to improve, I would say, is, really have a deep understanding of the workflow and the technology, or the problem that you're trying to solve before you select the technology. And so the fragmentation would be definitely the biggest thing. And I can give you a specific example. Transportation is a big part in PACE, because we provide the transportation to and from the center, from their home to the center, also to their physician appointments, DMV, things like that. And, there's a lot of technology out there to help transportation. But, what we've found so far, and, we continue to look, is a lot of the specific for the transportation technology, it's designed for just different settings that don't quite make sense at PACE. And so, late cancellations and route optimization, that's more important, say, in PACE, as opposed to, being able to upload, how they pay the fare, for instance, because we don't charge.
Yeah.
And so, hopefully we'll get to a point where the transportation lives inside the medical record, and it all lives inside one platform. So it's not as fragmented. So you don't have to take it out of one system and put it in another.
Right, or at least again. So the word that comes to mind is interoperability and potentially APIs, application program interfaces, right, between the different platforms, so that you enter a piece of information once, but it flows into the other systems with seamlessly, right, because of that API integration. And again, it gives you the other aspect related to integration to the fragmentation between the different care settings is health information exchange, right? Ensuring that you have all the information, all the latest interventions, all the prescriptions from the different providers who are outside of your organization, and again, sometimes even within the same organization, the PT department, for example, the physical therapy department has a different EHR from the generic EHR that the organization is using. Do you mind sharing what EHR are you currently using?
Well, so we currently use Calabrios.
Calabrios. Okay.
I've known them as RTZ most recently. Calabrios, they've gone through some transition.
Oh, okay. Yeah, I'm familiar with RTZ. Calabrios is a new name, so they must have been acquired and rebranded or something of that.
That has happened, yes.
All right.
But
great.
Yeah, I mean, I like what you just said there too about back on this workflow issue is really having a good understanding of that during that design phase, so that you get the product for the problem that you're trying to solve. So
exactly.
Yeah.
So let's tap into your imagination. If you had a magic wand to be used, whether it's an AI tool, a technology, or anything else, what challenge would you point it at for you to solve?
Well, just one, huh? Just one time.
You can have more than one. One.
Yeah. I think it would be, if I could solve one, it would be to have an intuitive system where it's all together. Because, there's being in healthcare, you can see the dollars, the resources that might go to regulatory compliance, or they might go to things that, really could be pretty far removed from the participant. And, and so my hope is that, we're not that far away from a driverless vehicle. Because transportation is such a significant challenge for seniors. And so I guess if I had to pick one, that would be the first thing I would ask for, would be a vehicle, a driverless vehicle.
Okay. Yeah, and I'm familiar with there are driverless even mass transportation that were, but the issue is that they're being in the context of senior living, they've been used mainly on private campuses as opposed to the general roads. But with PACE, the challenge is that people live all over a geographic area, metropolitan area, right? So that we're still a little bit far away from that, but we'll keep that in mind and try to help you.
Well, that along with all the the in-home monitoring technology, which there's an abundance of, We've
there's
got an
an abundance
opportunity
of,
to really perfect that.
Yep. And I personally worked on developing similar systems way back when I was at the University of Virginia, and I'm familiar with a lot of solutions. And I can help you. We can have a separate conversation about that, but I can potentially help you with that aspect. So, what are your goals for EverTrue PACE this year, over the next 3 to 5 years, whether it's in terms of growth, in terms of expansion of services offered to enrollees, and so on and so forth, retention of caregivers, or recruitment of caregivers?
Yeah, well, it's a good question. I think the first thing that we want to do, we want to maximize the independence of our participants. And, that's in healthcare, that can be a mindset shift, because a lot of times we want to do for people. And so PACE, when you think about maximizing the independence, it's teaching in a lot of cases instead of doing. And so, that would be number one, is that we continue to think creatively and keep people independent as long as possible, because it's why PACE exists. The other thing, we do want to serve more seniors, and it's more than just the numbers. In PACE, I've worked in senior living for over a decade, and we see some really difficult situations in PACE, and it really opens your eyes to the real need that's out there, and you see the continuing growing need that we all hear about. And so our program, for example, we've close to tripled in the last 2 years.
Nice.
And so we want to continue that growth. We want to expand that growth in St. Louis, because we see the need is significant. So that's number two. And the last thing is, we want to continue piloting technologies, specifically a real focus on in-home care. We have a testing ground almost here in PACE, a great opportunity, as you mentioned, or where we have the payments aligned, where we can try some innovative things. And so shame on us if we don't do that and figure it out, because that's what we're here to do. And it's going to help our industry and our seniors for years to come.
Absolutely. I think not only there is need, but there is also evidence that PACE actually produces positive outcome for those who need those services. And frankly, I personally, again, I'm a fan of PACE, and this is why I'm launching this series of podcasts about PACE, to raise awareness about it. And I wish that some of the other payment programs, like Medicare and Medicare Advantage programs, sort of do more or become more like PACE. Frankly, because it's a great program. I'm a big believer in it, and I hope to see a lot more people who are eligible opt to enroll in PACE program.
Yeah, well, I mean, how do you come up with something that's individualized yet serves an entire country group of people? And PACE is a great way to do that, because it is highly individualized.
Right.
And so, it has an advantage that maybe a larger insurance company, let's say, would have a hard time doing.
Right. But again, they can create most larger insurance programs have sort of sub entities focusing on different regions in the country. Mm-hmm. So they should be able to create something like this. And or partner with aging services like yourselves, right? Yeah. To be the implementers, but change the incentive structure so that you're able to invest in innovation, invest in technology, and improve outcomes, and reduce the overall cost to the payer.
Yeah.
which is
That
the country, the government, right? Ultimately.
Well, and that collaboration with other organizations I see that happening more and more and becoming more and more important. We've had people approach us, as an example, that would like us to operate a primary care clinic in their senior center.
Yep.
And so
that's a great, yep.
Yeah. And so there's use cases like that, not only, and even for other populations, I think this model could serve as.
Absolutely. Yeah. As a template. Yes,
Yeah.
Absolutely. So finally, what advice do you have for our listeners, whether these are aimed at senior living leaders, technology developers, payers, patient, legislators, older adults, or caregivers?
I think the thing that jumps out at me is there is from my perspective, you can get, I think, in a rush to get to the solution, especially with technology. And I think that carefully planning in the beginning and looking at how does this technology fit within the entire stack, as opposed to a standalone solution. I would say getting it right is more important than being first. So
you've hit the nail on the head, and this is exactly what I have tried to emphasize and do when I was at Leading Age, the Center for Aging Services Technologies. I developed these technology planning and selection tools, and I emphasize the importance of proper planning, identifying the problem, pulling the right team that the technology is going to touch, all the way from the frontline caregiver to the managers and the C-suite, even sometimes, right? So you're absolutely right. So where can people learn more about you or about EverTrue PACE? Do you want to share any websites or social media links?
Yeah, I would encourage people to visit www.lsslive, or excuse me, that's our old EverTrueLiving.org. I'll say that again, www.evertrueliving.org. We rebranded our name in the last year. So
excellent. It's a great name. It's a great name.
It is. It is.
Well, thank you so much, Drew, for your time today. This was a very exciting conversation. And again, thank you for your time. Thank you, everyone, for listening. And stay tuned for more episodes about PACE and innovation in the PACE program. Thank you so much.
Thank you.